Hello everybody, I am Dr. Sunanda Chava. I am a old medicine specialist. Today I would like to talk about diabetes mellitus. So diabetes mellitus is the most common metabolic disorder where you have increased blood glucose levels, and it's clinical and genetically heterogeneous metabolic disease with increased blood sugar levels and dysregulation of carbohydrate, protein and lipid metabolism. So you have sweet urine in diabetes mellitus, the triad, that is polyuria, polydipsia, polyphagia, that is increased urine formation, which is called polyuria. Polydipsia is increased thirst, and polyphagia is increased eating a lot, voracious appetite. So these three will be present in diabetes mellitus. So it affects the multiple organs like eyes, nerves, kidneys, and blood vessels. So it can affect any part of the body. And the diabetes mellitus people are prone for infection. This is because the sugar or the glucose in the tissues will act as nidus for bacteria. So they cause infections, and then chemotactic activity of neutrophil is affected, and you have atherosclerotic changes in blood vessels. So these three are the reasons for the increased proneness to infection in diabetes mellitus. So you have a few types. You have type 1, type 2, other, and gestational diabetes mellitus. So in type 1 it is insulin dependent, so beta cell secretion of insulin is affected here. In type 2 the cells are refractory to the action of insulin hormone, and you have other like genetic defects in beta cell function. Insulin action is affected due to gene defects, and you have pancreatic diseases and all. So you have some syndromes also, like Klinefelter syndrome, Turner syndrome and all. You have fourth type called gestational diabetes mellitus. The pregnant ladies after childbirth might go. There might be diabetes mellitus occurring in pregnancy. Usually, obese women are commonly affected. So, so there is increased insulin resistance in these ladies because of obesity or age is more. That's the old ladies becoming pregnant. So this happens during pregnancy, and it might go off after childbirth, or it could continue it as after few. It might continue as type 2 diabetes mellitus. So here the problems are all due to increased blood glucose levels. So as we know, insulin causes less blood glucose levels. If there is any deficiency in the insulin, or the tissues are refractory to insulin, there will be increase in blood glucose levels. So diabetes mellitus is a nuisance disease. It affects many organs. So we have some signs and symptoms of polyuria of diabetes mellitus. That is polyuria, polyphagia, polydipsia, unexplained weight loss, poor wound healing, blurred vision, obesity, gingival bleeding, high susceptibility to infections, easy fatigability, visual impairment, neurological symptoms, that is numbness, dizziness and weakness, chest pain, genitourinary symptoms, that is urinary incontinence, gastrointestinal symptoms, and microvascular or macrovascular complication, sexual dysfunction, gingivitis, periodontitis, multiple periodontal abscesses, and you have some dental considerations in this diabetes mellitus. So the uh, symptoms of what is the dental considerations in this diabetes mellitus is these uncontrolled diabetes mellitus or diabetes mellitus. You might see many stomatopyrosis or burning mouth syndrome cases. So there will be oral dysesthesia, increased infections like candidiasis, that which is more common. There will be viral fungal infections also, because the immunity in diabetes mellitus is reduced. The neutrophils can be defective in chemotactic action. So there might be sialosis, that is non-neoplastic, non-inflammatory enlargement of salivary glands, most commonly parotid. There might be dehydration because of polyuria, and then xerostomia, increased periodontal problems, and then there might be more dental plaque accumulation in these diabetic people. So they are prone for periodontal conditions, and BP might be increased, blood pressure due to increased atherosclerotic actions in blood vessels, and then um, the sugar in these blood glucose levels, the blood glucose, when it is increased, it will act as nidus for bacteria. The chemotactic action of neutrophils is affected, and there will be atherosclerotic changes in blood vessels of diabetes mellitus patients. So because of these three reasons, the diabetes mellitus people are more prone for infections. If infected, they are more prone for complications like osteomyelitis, dry socket and all. Then they might be prone for viral and fungal infection. So then osteomyelitis can occur more in case of dry socket, in case of diabetes mellitus patients. So what is the symbol for diabetes mellitus is blue circle. Before it was gray ribbon. So in 2006 they have changed it, and the symbol for diabetes mellitus is blue circle. So what are the complications of diabetes mellitus from medical point of view is the patients might become hypoglycemic if the insulin is given more, or if and there might be hyperglycemia, which is could be due to which is due to uncontrolled diabetes mellitus. So what are the differences between hyperglycemia and hypoglycemia? Feeling in hypoglycemia, you have dizzy feeling or light-headed feeling, and in hyperglycemia, you might have acute symptoms or chronic ones. So the tired feeling will be there in hyperglycemia. You have blurred vision in both the cases, that is in hypoglycemia and hyperglycemia. And in hypoglycemia, you feel sweaty. The patients are sweaty, and then cold clammy skin will be there, that is pinchable skin. And then there will be difficulty in concentration in hypoglycemia, and there might be weakness, sleepiness, irritability, difficulty in concentration, making decisions, and all this you find in case of hypoglycemia. In hyperglycemia, you have acute and chronic. In acute, you have tired feeling, blurred vision, frequent urination, increased thirstness, that is polydipsia. So in chronic, there will be darkening of the skin under armpits, necks, thighs. You have fungal infection, candidiasis, ringworm infections like tinea, weight gain, sexual dysfunction, paresthesia or numbness or tingling or burning sensation of feet, mouth. Then how do you, whether in case of hypoglycemia or hypoglycemia, you have, if you're not sure what's the problem patient is that is hypo or hyperglycemia, you can directly, if the patient is fainting or not responding, or if the patient is drowsy, or patient has some problem, so you give the blood glucose level glucose solution to the patient immediately, whether hypo or hyper. It won't cause any harm, and the patient will get up and sit. And so in hypoglycemia, the patient is if the patient is awake and he can take orally, he or she, you can give 15 grams of carbohydrate. If the patient is unable to take orally and the IV is in place, you can give 25 to 30 ml of 50% dextrose or 1 mg glucagon. And then if the patient is unable to take orally and IV is not in place, you can give subcutaneously or intramuscularly 1 milligram glucagon anywhere in the body. So glucometer is used to measure the blood glucose levels. 110 is the 90 to 110 milligrams per dl is a normal fasting blood glucose, and it has to be more than 200 milligrams per dl to be called to be for the diagnosis to be given as diabetes mellitus. And glucometer is used to measure the diabetes mellitus. Food intake: increase fiber food, less sugar should be eaten, should be taken in diabetic people. Exercise is very important, and they have to have diet control, and they have to eat the diet which has been given for the which has been told by the physician. And then what are the oral hypoglycemic drugs you can give? Most common is metformin, and then you can give insulin in insulin dependent or type 1 diabetes mellitus. So in people, in dental patients, you can usually you're doing the procedure either before or after peak activity of medicine, anti-diabetic medicines. And then there's no need for there's no contraindication for use of epinephrine in LA while giving LA to the patients. So because it causes very negligible amount of increase in blood glucose levels, epinephrine, so can give to the patients, that is lignocaine with LA. So there might be some drug interactions and all you need to see before uh, giving the medication to the dental patient. If he is diabetic, if he or she has diabetes mellitus. So this is in general, I have spoken about diabetes mellitus. Hope this will be helpful to you. Meet you in the next video. Bye. Thank you.